Hi, and welcome to the Wesley Orthodontics YouTube page. Today we are going to be talking about a pendulum appliance. A pendulum appliance replaces old school headgear, and what it is used to do is to push your upper molars back, which is going to help eliminate any crowding you may have of your upper front teeth, as well as push your molars into what we call a class 1 bite, which gives you a nice stable bite. The pieces of the pendulum are here. You have the pendulum itself, which is this appliance. And then in order for the pendulum to get a good grip or push motion on your molars, we have bands. These here are the bands, just like you see me slipping it off here, we would slide this onto your tooth. There's the little bracket attachment along with a little attachment to where the springs of the pendulum will go. So when you get this appliance on, we would push these on with glue around them. Clean off any excess glue, make sure that all the slots in between are filled so that you're not getting any cavities where the bands are at. And then Dr. Wesley would take the pendulum, he builds up some glue on these two teeth here so that when you bite down, you do not bite down onto your back molars. This allows them to move faster without any bite pressure. And then to get the springs in, they actually just activate and slide right into those little attachments I showed you here. This is easier with our instruments. And this is what you will walk out of the office with when you get a pendulum. Now, like I said, there will be glue on these teeth, so when you bite down, not as much as a finger space, but your bite will be propped open to allow space so that your molars don't touch so they can move back. With this appliance, you do touch the roof of your mouth very often. One of our main complaints about it is that these little springs here, you'll get little coil marks on your tongues. What you can do for that is apply wax. And for the wax, you would just break, I'd say about a finger space off. You kind of want to warm it up in between your fingers. The softer it is, the better it's going to work. And then what you would do is just push it right up into your mouth against the springs. Doesn't have to be any exact technique, just kind of push it up there. Go ahead and do the same thing for the other one. And what that will do is take that rough edge out. Also, with this appliance comes limitations on what you can and cannot eat. Our recommendation would be nothing sticky, gummy, chewy. Sticky, gummy, chewy things are going to get caught in the springs of the appliance to cause it to malfunction. They can get caught in between the appliance and the roof of your mouth, which makes for a very uncomfortable fit. If that happens, the only way for us to clean it out is to completely remove the appliance, which could cause damage to it and could reset your treatment back a few steps before we could put it back on. We also say extremely hard things. Our bands are bonded on there very strongly, but if you're crunching into a very hard candy, something frozen, it's very likely that that band could crack. That's all there is for food limitations. We also say with long stringy foods, spaghetti noodles, fettuccine noodles, all that kind of stuff, you want to cut down into smaller pieces just so it doesn't get caught in between the appliance and the roof of your mouth. To clean anything like that out, we would recommend just swishing with mouth rinse or water after each meal, and then brushing. You're just going to brush your teeth like you would normally without the appliance. Most important thing we really stress to all of our patients in our office about this appliance is there is supposed to be a thin space in between the appliance and your roof of your mouth. When you get this in the first day, you are going to feel pressure on your teeth because it's pushing your molars back. But if for whatever reason you feel like somebody is taking their thumb and pushing on this little plastic piece as hard as they can, it'll hurt to swallow, it'll hurt to talk. Call our office immediately. If you do not reach us, you get the voicemail. Listen all the way to the end of the voicemail. Dr. Wesley will leave his number. He can help you if it is an orthodontic emergency. So just keep that in mind. A little pressure is normal. We're moving your teeth, but a lot of pressure is a big deal. Call us. I hope this answers any questions you have about this appliance. If we missed anything, again, our office tries to be as available for you as we can. We thank you for tuning into our YouTube page. Don't forget to check us out on our website, Facebook, Pinterest, anything you can think of to contact us. We try to get there for you. You guys have a great day. Thanks. Bye.